So diuretics, these are probably the best known and recognized drug that are important for the renal system. And so all of their job then is to increase the excretion of water. And so they're also used then to help control blood pressure and to decrease edema where we had fluid accumulation in different tissues and interstitial fluid. And so diuretics then increase urine volume so that we're getting rid of water, and this is going to then, in essence, decrease the blood volume and the interstitial fluid volume. And so different types of diuretics will act on different parts of the nephron. All right, so some tests to determine the function of your kidneys. The first one is with inulin clearance. This one helps to diagnose nephritis or renal insufficiency. However, the only way to actually test this is to determine or to administer inulin at a continuous rate. So an IV has to be administered. And because the GFR is going to be equal to the excretion for this one. Also, another example is the urinary albumin excretion rate, and so this is to determine above normal albumin excretion, which albumin is important to maintain and keep within our blood system because this is a globular protein found in blood plasma that helps with a lot of blood transport of ions and water and fatty acids and hormones. So if there is an above normal excretion rate of albumin, then this is called microalbuminuria, and a chronic condition of this can signify renal damage, and so due to hypertension or uncontrolled diabetes. Another test is proteinuria. We've talked about this before, and so problems with filtration at the renal corpuscle would have proteins that are being filtered and excreted, and so this would be some type of problem for your nephrons. Acute renal failure, this is when there are issues with the kidneys that are unable to regulate the blood volume, the pH, or different solute concentrations, and it's very rapid, so within a few hours to maybe a few days. And so decreased blood flow to the kidneys then are the cause of it, and this might be due to atherosclerosis within the renal arteries, inflammation of the renal tubules, so maybe with some type of autoimmune disease or some type of virus or pathogen, and also use of some NSAIDs, so non-steroidal anti-inflammatory drugs. Glomerular nephritis is inflammation of the glomerulus, may be caused by some type of autoimmune disease where antibodies are attacking in response to, say, like some type of strep infection. And so a lot of glomeruli are becoming destroyed, and this allows for those larger permeability within the filtration slits, so allowing proteins to flow out. And so this will decrease osmotic pressure and then can lead to edema, but also long-term then is we have problems with protein production and also transport of different proteins throughout the blood, as well, including hormones, different ions as well, and also differences in water. With renal insufficiency, this is a decrease in renal activity, and so can be cause of any of the topics we've talked about before, like glomerular nephritis, diabetes, atherosclerosis, or kidney stones. And so due to that, we can have an increase in blood pressure into the renal artery and arterioles, and so this can cause then an increase in blood potassium and hydrogen, and also can cause blood within the urine. And so uremia, so this blood in the urine, a lot of patients are put on dialysis to help with the clearing of these solutes and to reabsorb the materials and the solids that we do need. And so dialysis then is when an artificial kidney is in place. And so hemodialysis, this is when the blood has cleansed of waste and is passed through the dialysis fluid. And continuous ambulatory peritoneal dialysis is when the fluid is introduced in the abdominal cavity where waste can pass out of the abdominal blood vessels, and the fluid then is going to be pumped out of the abdominal cavity so that we have clean urine that is going to be excreted in the end.